Let's meet an inspiring cardiology leader. I'm Kate Save. The Inspired CEO starts now. Welcome to The Inspired CEO, where each episode we explore the innovative wellness practices that are driving success and longevity in the modern business world. In this episode, we sit down with a visionary CEO spearheading innovation in cardiology. Joining me now is David O'Donnell, founder and CEO of Advara Heart Care. Thank you, David.
No problems. Good to be here.
Well, tell me, what inspired you to get into cardiology?
Yeah, look, it's a really interesting question, and a lot of my colleagues and friends come up with great answers for what inspired them to get into healthcare. Yeah, mine's a little more basic. I've always been fascinated by the human body, fascinated by physiology, how things work. So getting into medicine was actually a really easy choice for me.
Yeah.
And once you're in medicine, there's lots of avenues you can go down, and for me, cardiology had the opportunity to use your intellect to diagnose problems.
Yes.
You get to use your hands to operate.
Yes.
And you're also a psychologist. You're working with patients to manage their health. So I often wonder why anyone would do anything but cardiology.
Yeah.
Because it seems like the fascinating thing, a combination of everything you could possibly want in a career.
And such a critical organ in the body.
Absolutely. I often say, we've got the intellect of a physician, the hand skills of a surgeon, but you've also got to be an emergency doctor because people's hearts stop. So it can be pretty dramatic at times as well.
So it's a lot of training to get through to where you are now. What did that journey look like for you?
It's one of those things, and it's interesting with the Olympics being on now. It almost feels like you're preparing for the Olympics. It's a multi-year program.
Yeah.
And my training was partly in Australia, partly overseas. I was very fortunate. It came at a time when things were changing at a dramatic rate. So I spent a lot of time in Europe learning some of the newer techniques around heart surgery, and came back to Australia and got to practice them. So it's a long journey.
Yeah.
You start uni at 18, you're probably in your mid-30s by the time you're ready to go as a cardiologist. So it's a long journey.
So you've really got to love what you do to keep going, because it's not months, it's many, many years and decades in.
Look, again, I've got two young kids, and they say, would you want your kids to do medicine? And I say, you should never want anyone to do medicine.
Yeah.
If you want to get into healthcare, and you know this, you only get into healthcare if you're passionate about it. If you're not passionate about it, the long hours, the phone calls at 3 a.m, they're going to drain on you after a while. So if you're passionate about healthcare, it's the best thing in the world to do. You're in a really privileged position in someone's life where you're actually impacting on their outcomes. And that's an enormous privilege. But unless you're passionate about it, it's not something you're going to want to do.
So what is your primary goal? As the CEO of Advara Heart Care, how do you envisage that you can change lives? And what keeps you really pushing every day and growing?
Yeah, look, it's a really interesting question that we set up our business some time ago with the priority of improving Australia's heart health.
Yes.
I often tell people, your company should always start with a really powerful vision. Mm-hmm. Now, if improving Australia's heart health doesn't appeal to you,
yes,
then you're not the kind of person I want to work with. If you're going to work for something, improving Australia's heart health is about as good as it gets. So I think we're in an enormous position of privilege that we can do that. But with that comes an obligation.
Yes.
And it's the obligation to inspire people to change what they do around their heart health is what really drives me.
That's an interesting comment too, because I think just telling people what to do for heart health isn't going to achieve anything at all. You have to motivate and inspire them. And how do you do that? And how do you lead your team to do that?
Yeah, look, again, I can tell you this as a cardiologist,
yeah,
which I'm only now on a Friday,
yeah,
but as a cardiologist, I often said that the number one skill is not how well you put the stent in. It's not how well you put the pacemaker in. It's not even how well you prescribe the drug. It's getting the patient to buy in to their health. Because if a patient buys into their health, if they become engaged in what's important to them, they'll take the medication. And in fact, we should be judged on how compliant our patients are with their healthcare needs. Rather than being judged on how well we prescribe something, we should be judged on how well that is actually taken, and the compliance is really vital to me. So that's part of what we've done as an organisation, is trying to emphasise quality outcomes. Not emphasise procedures, not emphasise volumes, but emphasise quality outcomes. And every doctor in our network has their quality outcomes measured. And we're incredibly proud of that. If you see an Advara cardiologist, he has world's best outcomes because we measure them. And we measure them, we analyse them, and we report them back to our cardiologists so that all of our cardiologists know. And it's well known in psychology that if you measure something, you improve it. But if you also provide the feedback and education and training, you improve it even more. So I'm really passionate about the fact that it can be confusing. Which cardiologist should you see?
Yeah.
Which specialist should you see?
Yeah.
And a lot of people don't like to publish their results. We're very proud of our results, so we're very happy to publish our results and tell people that, we're going to work with you to improve your healthcare.
And that is flipping medicine on its head a little bit too, that you're trying to get the patient to own their health rather than the doctor telling the patient, this is what you do and I will control your health. You're getting them to own their health and taking them on that journey and supporting them. What other innovations have you got in your organisation, and where is the Heart Health of Australia? How far are we on this journey?
So look, again, where is Australia's heart health? It's pretty poor.
Yeah.
We're one of the countries with the highest rate of heart disease, and that relates to all of the factors that cause heart disease. And there's a big long list,
yes,
but the few that are really relevant in Australia: obesity, lack of exercise, diabetes, high cholesterol, poor diet, processed foods. There's a lot of things that go in there. When I was training as a cardiologist, the focus was all on do the operation as well as you can.
Right.
So everything was focused on the operation. That is incredibly important. But most cardiologists are pretty good at that bit.
Yes.
What's really important is the before care and the aftercare. And what I'm passionate about is how we actually deliver better aftercare to patients. And I can't do all of that.
No.
My job is to actually get the process in place and then to use the right people to facilitate that, using exercise physiologists, using dietitians and nutritionists, encouraging people to manage their mental health. All of these things have a powerful impact. And it is a team sport. For many years, doctors thought they were playing this solo. It's a team sport. We're part of a team that manages the patient's healthcare. We won't get too much into politics, but the Australian healthcare system isn't really set up for that team care approach, and that's why you need these innovative models that allow us to pursue that.
Very interesting you say that too, because when I think about healthcare in Australia, it is that example of people at the top of the cliff and the ambulance waiting at the bottom to catch them and nothing in between, that we should be stopping people falling off the top of that cliff, and that is something that Advara Heart Care is addressing. So what are you doing in prevention or management prior to heart events?
Yeah, look, again, you're spot on. Far too often I'm seeing someone for the first time when they've blocked their artery. I'm seeing someone for the first time when their heart's gone out of rhythm. Now, in retrospect, it's the 10 years leading up to that is where you can have a really powerful impact. It's getting the patient at the right time on the right treatment and the right lifestyle measures. Now, that takes a concerted effort to figure out who are the at-risk patients. This is not screening. Screening is a slightly different problem. This is identifying elevated risk patients. If you can identify some people who are at elevated risk and manage them, you have a profound impact. We all know that smoking is bad for you.
Yes.
And we know the longer you smoke for, the worse it is.
Yes.
We haven't quite got that with cholesterol and diabetes yet. Having high cholesterol at 40, your risk of heart attack might not be in the next 6 months or the next 5 years, but it's definitely over the next 30 years.
God.
So let's get to these people when they're young enough that actually having this effect on their cholesterol, having the effect on their diabetes, having the effect on exercise. If you do all of that at an early enough age, we're going to prevent significant amounts of heart disease later in life.
It's interesting you say that, because I lost a colleague a few years ago who had a heart event in the end, but he'd had diabetes for 20 years, and his GP had said to him when he was 40, these are the things you need to do, otherwise this is where you end up. And he said to me before he died, he'd had multiple amputations by that stage, that he wished he listened to his doctor earlier. What have you heard patients say after that first heart attack? Is there something that surely you hear these stories all the time?
Look, again, I wonder if it's something that you and I have also said to ourselves at times. We're just too busy.
Yeah.
I often hear people are too busy. They don't prioritise their health. We're all busy. And there are things that get put to one side, but managing your health is not one of those things that should be put to one side. We know there's a lot of things that contribute to poor heart health. Sitting. We should all be using standing desks. Do we all have standing desks? No, not everyone does have standing desks. Why? Oh, I just haven't got round to doing it. We know we should go for a walk at lunchtime. Why don't we? Oh, I was a bit busy, so I didn't do my lunch at walk time. It's really actually saying, I'm going to prioritise my health.
Yes.
No one, this is not patients that I've heard, but it is patients I've heard, but it's also well known that no one at the end of their life says, I wish I'd worked a bit harder.
That's right.
No one at the end of their life says, I wish I'd done a few more hours on that job. It's, I wish I'd spent more time with family. I wish I'd travelled a bit more.
Well, they are my next two questions is how do you manage your balance with your family and your work life, and what do you do for your own health?
Look, again, I'm you've hit me at a good week, because once every 3 months my wife's actually out of town, and it happens to be this week. So I'm really juggling. She owns her own business as well. So this week it's all of the kids driving around falls to me. There's a few things that I say there. I think balance is different for everyone.
Yes.
I'm not the kind of person that needs to sleep in on a Saturday morning till lunchtime. I'm not someone that needs to finish work at 5 o'clock and not turn my phone on till 8 o'clock the next morning. I'm passionate about what I do. So balance for me is making sure I can fit everything in my week.
Yes.
But it doesn't mean I'm sitting on the couch at 5 o'clock watching TV. I think that one of the keys for me is actually starting each week with a pretty structured plan. It sounds boring, it sounds easy, but Tasha and I sit down on a Sunday night and we work out who's dropping the kids where. What I want to do is I want to do as much work as I can in a week, but I want to make sure I'm getting my exercise. I want to make sure I get to at least have one game of basketball with Jade, and I stand in a soccer goal while Jonah kicks balls past me with Jonah. And I now actually coach the under 12 soccer team by default, because no one else would do it. But these are all the things. These are all the things I want to fit in my life. So I make a decision. I'm going to fit these things into my life.
Yes.
And once you make the decision you're going to fit them in, you fit them in.
So true, and it is that prioritising, but the way that you've done it is very clever. You've got the fitness and the sport with the children, so you've made a commitment that's not only good for your health and their health, but it also gives you that family time that a lot of people sacrifice.
And it's the mental health benefit that comes with this. It's enormous as well. I'm a real believer in, if you're doing something, do it 100%. So when I'm at the park playing basketball or kicking the soccer ball, the phone's not in my pocket. The phone's in the car. So I'm 100% focused on that time on what I'm doing. And the mental health benefits of that are additional to the physical benefits of it.
And if you had one thing that you think is absolutely part of your success, what is it with your routine that you would never give up?
So I'm a swimmer. And swimming is magnificent as a cardiologist and as a CEO, because phones are not yet properly waterproof. So the thing that I enjoy most is jumping out in the ocean.
Yes.
You're from Melbourne as well. It's a little cold in the bay right now.
It's a good cold shock. I'm
in the pool over winter, but over summer it's in the ocean. That's my 1 hour. I try and do that, with a group of masters at the moment. We swim from 5:45 till 6:45 each morning.
Fantastic.
Get dressed, have breakfast, into work, get my emails for the day. And that's my time, is that early morning before anyone else gets to work. It's a focus for me, and that's Monday, Tuesday, Thursday, because Wednesday and Friday I take the kids to school. So it's actually getting that balance, but it's pre-specifying how you're going to do it.
Incredible. It's so great to hear about your lifestyle and how you manage it, and I guess the things you won't compromise on, because it's what's got you to where you are today, and what a fantastic role model you are to your children as well. So thank you so much for sharing with us today.
Thank you.
This is Ticker. We'll be right back.
You're watching Ticker. We'll have more in just a few minutes.